welcome once again to Senior Focus. I'm your host, Bill Adams, and Senior Focus comes to you thanks to Channel 20 from Armstrong Cable, and thanks to Greg Groten from Armstrong, and also thanks to Keith Kaiser from Mill Creek Metro Parks. We're at the Davis Visitor Center where we film the show, and thanks to the folks at the Metro Parks. If you haven't been out here for a while, please come out any season of the year. It's a beautiful place to be. Today we're going to be talking about geriatric care managers and what they do and what that is. And as my guest today to explain that, we have Rebecca Rains.
Hi.
Thanks for coming. Hi.
Good afternoon.
Now, Rebecca, you're an RN, right?
Yes, I am. Yes, I'm a registered nurse.
And we might as well just start with the basic question. What's the definition of a geriatric care manager?
Well, a geriatric care manager is a professional that is licensed, either a social worker, a nurse, can be a geriatric specialist. They are a specific professional body that specializes in health and human services, and that can assist older individuals and those with ongoing complex needs, and the family members as well. Mm-hmm. So we specialize in what we try to do is assist families and the individuals to alleviate some stress in their lives and to direct them to the highest quality of care and to manage their life as possible.
Mm-hmm. Now, this is a rather new field. I'm guessing, I've heard of this before, but it's probably within the last 10 to 20 years. Is that correct?
Well, they've been around, I believe, for about 20 years, but mostly working for large organizations, possibly hospitals. A lot of people think of care management as discharge planners in a hospital field, but they've been around, but maybe 10 years, 15 years for individualized, a lot of people who are entrepreneurs in this area.
Now, why don't we start with what area you cover physically, geographically, and how people might contact you, and again, we'll repeat that later on.
Okay. I cover the whole entire Northeast Ohio, and so we are all over the Northeast Ohio. I can be in Youngstown one moment, or on one side of Youngstown, be on the other side of Youngstown, and then also go to Cleveland within the same day. You can contact me several ways. There is my webpage, which is transitionalcaremanagement.com, or my phone number, 330-962-8494.
Okay. And how who's most likely to get a hold of you, I guess? Would it be maybe the senior themselves, or a person who has some kind of needs, or is it a family that calls? Do you get maybe professionals, or who calls?
Well, we get a mixture of phone calls. I would like to think that the seniors themselves contact us more often, but they don't. They mostly, who contacts us is the family members, the children, maybe a spouse, could be a spouse of one of the, maybe another ailing spouse they have. I do get contacts from attorneys. Attorneys will call for either their guardianships or also people who come into their firm to discuss powers of attorney. They may come in and start saying, I'm not quite sure what to do with mom or dad, and then that they can relate that to my specialty area. So we can go out and look and see a little bit more detail of their needs. So
you get that original call, say, and someone wants you to come make a visit. Can you walk us through the process? What happens when you go on the initial visit? What kind of, how long that would last, what kind of information you gather?
Sure. What we do is we go out and we need to go into the actual living area of the individual. This gives us a very broad idea of the needs. We look at the medical and the social needs of the individual, and also the family, the caregivers as well. The typical would be 2 hours. We try not to go more than that. We'll come out to the home. We'll do what's called a geriatric assessment. We look at, again, their medical, their social, their financial, if that's something that we can help them with as well. We look at the environment. That's a really big area, too. We will do a safety walk. We can give suggestions to improve the home, to keep them in the home as long as possible. After we've gathered all the information, we can also meet with family members or caregivers outside of that visit as well to collect all the data. After that visit, we will prepare a care plan, which takes about another 2 hours, depending on what the needs are, again, for that person. So there's about a total of 4 hours, 4 to 5 hours, that entails in the whole assessment. After we have prepared the care plan, which are based on nursing diagnosis, we look at the issue, the problem, what we are going to do to resolve this problem, and then references or options to get to that point. We will sit with the family as well and go over the care plan itself.
Mm-hmm. Now, when you go out and make these assessments, do you find seniors are cooperative, or does it kind of there's a wide range, from some who are very happy to see you to others who, who are you, what are you doing here, that type of thing?
Yes, you probably couldn't have said it any better. We get it all the way from so glad we're here, we've been waiting for someone like you, to you're not going to take my independence away. We're doing just fine. We don't need anyone like you. My kids are just, they're panicking. They're over dramatic about it. But once we get into the home and we show them how much we can do for them and how to alleviate a lot of the stress and the complexity alone of navigating the healthcare system is just beyond anybody. I mean, it's hard even in the medical field, but to have no medical experience and background, it's very overwhelming. So we get very, very defiant, but usually it works itself through.
Mm-hmm.
So,
well, what you just said was very interesting, and again, I guess that would be one of the main points for talking with the geriatric care management manager is the complexity of the healthcare system, long-term care, Medicare, Medicaid. Maybe at this point, if you wouldn't mind, you could talk about your own background,
mm-hmm.
which led you to, becoming a care manager. How did you get involved with this?
Oh, I've been a registered nurse for 19 years, over 19 years, and I have a very broad experience in a very broad areas.
Mm-hmm.
Starts with anywhere from neonatal, because our services are open to infants to the older adults.
Okay.
So my career began as a neonatal intensive care nurse, and actually it began the first year, I apologize, in the medical surgical, as they always recommend in school. So I worked with chronic illness older adults at that time, and then moved to the intensive care. I was an intensive care specialist for many years in the pediatric field, and then went to working again with the older adults. So the last probably 10 years of my career have been working with the acute and chronically ill for older adults, and the MRDD
mm-hmm.
as well, the developmental disabilities.
So your clients will take in that whole range then, as you're saying, from infants all the way to people in their 90s or
Yes.
100 years old?
Yes.
And also developmentally disabled adults?
Yes, developmentally disabled adults we can help as well.
Okay. And this, though, is now your business, right?
Mm-hmm.
Is that correct?
Yes, it is.
And how long has Transitional Care Management or your business been in existence?
We've been in existence for over 3 years. I was actually started off by doing this part-time and juggling going to work night shift at a hospital. So I continue my experiences hands-on as a nurse until about 7 months ago, and we've been full-time, I have been full-time working with the company and working with individuals and their families all around Northeast Ohio for the last 7 months.
Now, you're part of a national organization, is that correct? I mean, could you walk us through, if people are looking for a care manager
mm-hmm.
Or a company that does this, maybe describe what that national group is and how
Yes.
that works.
I'm a member of the National Association of Professional Geriatric Care Managers. That's a mouthful.
Mm-hmm.
And we are online. It's www.caremanager.org.
Okay.
And anyone out there, even if you live locally and you're trying to find a local care manager, or possibly your family members live in another state, there is a section there that you can put in the zip code or the location, and they will list for you the care managers that are part of this program. We have very very strict ethics and codes and ethics that we have to follow as a member. To be a member, you have also professional, not licensure, but well, it is licensure because they want social worker. Mm-hmm. You can also have other medical experiences too, or license. I'm sorry, mm-hmm. And we're very, very close-knit group. We follow again a lot of strict codes and ethics to be a member.
So if you get a call from, because this is the situation I think in our area, we have a lot of the seniors who are here now still living, mm-hmm. but all the family has moved away, yes. maybe to Arizona or somewhere south or something like that. They may call you from out of town, mm-hmm. is that correct? And then you're having to deal with them maybe over the phone, absolutely. But you're checking on their loved one, their family member here in Mahoning County.
We get that. That is probably 90% of the actual business that we get. I get phone calls from children as far as California right now, and they will call and share their concerns, talk with their family members. If they are not able to communicate to their family members their concerns, I will assist them as well in some key points in trying to break the ice, so-called, as you may think, to be able to introduce bringing me in to help them. What we do is we will go out again and do what I had mentioned before, go out and do an assessment, prepare a care plan, and then if they want us to continue, we can do a lot of oversight and monitoring. I have several clients that I will go out and check on them once or twice a week, depending on their medical condition. And it takes about an hour, each visit. If they have doctor's appointments, we will attend the doctor's appointments with them, and so we can prepare and ask the most appropriate questions. If it's okay with the older adult, mm-hmm. we will also communicate and report back in a report form, email or phone, back to the children who were the ones that originally hired us.
So yeah, that was one of the questions I was going to ask. Your client then is the older adult, basically, right? You're trying to do what they would want or work with them, mm-hmm. because sometimes I know, just my own experience, there are conflicts between not only the older adult and the children or other family members, but between siblings. One mm-hmm. thinks something should be done and somebody thinks something else. So that must be part of what you do. Then try to get everybody on the same page. Is that fair assessment?
That is very fair assessment. One thing that I have noticed is when children try to come in and assist, and I know that's what they're doing, they're trying to help and assist their parents. The parents do not view it as that way. They view it as, you are the child, I am the parent, and you're not going to tell me what to do.
Right.
So most of the time, bringing in an outside third party helps keep that parent and child relationship going as it should be, but also in the same sense they get that assistance that the children are so much needing to calm their worries and alleviate their stresses. But yes, we are, to get to your specific question, we are working for the actual individual, the older adult. Mm-hmm. So once we are called by the family member, we then, and papers are signed for, contract for services, we actually are working directly for the older adult. We can sign what's called HIPAA consents to be able to communicate with the children. Anytime, though, that there's a safe or an environmental concern, then sometimes we do have to reach out to the family members at that time. But
you mentioned that you work with attorneys from time to time, and again, that would be something, I guess, that comes up pretty frequently. Making sure things like powers of attorney or durable power of attorney for HealthCare, those kind of things are in order. Is that something you review with your clients when you talk to them?
Yes, absolutely, we do. We make sure that, again, we go through all their medical, their social. We will look at making sure they have all their legal and financial paperwork lined up. So many people, including individuals my age, and younger, they should all have that all ready to go as well. Powers of attorneys, advance directives.
Sure.
Talk to your family members. Let them know. It's very important that if when I come into a home and they don't have that paperwork already prepared, that is a big area that we work on. And if they don't have an attorney, then we can go out and help them, give them several options. We are very much out there doing some community referrals and resources for these individuals as well.